Good afternoon and welcome to Arkansas Children's. We are doing our Facebook Live remote. And this afternoon, I'm joined by Dr. Harrison Cobb. He is a pediatric cardiologist at Arkansas Children's Northwest in Springdale. And it's perfect timing because February is Heart Month. And at Arkansas Children's Hospital, Arkansas Children's Northwest, we are focused on hearts year round, but we have a special focus in February. And we want to talk about heart health, ways that parents and caregivers can keep their kids' heart healthy during this time, activity, and also what to look for if there are some symptoms and their kid's heart isn't doing well, when to be concerned and when to seek medical help from their doctor. So Dr. Harrison Cobb, welcome to our Facebook Live remote.
Thank you. Hello.
So before we dive into heart health, tell us a little bit about yourself and your training.
So my name is Harrison Cobb. I grew up in Texas and went to college at Harding University in Searcy, Arkansas, which is how I was introduced to the state, and then went to various places for my medical training, but ultimately ended up in Little Rock doing my completion in pediatric cardiology training. And then after finishing it, I was hired by the cardiology group to work up here at Arkansas Children's Northwest.
Welcome. And you've been there for about 7 months now. So tell us about the type of patients that you usually see in your clinic.
Yeah, so I see a mixed bag of patients. Approximately half of them are kids who were born with congenital heart disease that may need surgery in the future or may have had surgery and just need continued cardiology care. The other percentage of my patients are just a variety of complaints like palpitations, chest pain, fainting spells, or any heart murmurs that maybe a local pediatrician or physician hears. They all get sent to me for evaluation.
And just like you mentioned, some conditions are unavoidable. If you're born with a heart condition or a heart disease, you can't change that. But what are some things that parents can do to keep their kids' heart healthy?
Great question. So there are many things that are unavoidable, such as genetics and family histories. But there are other things that we know in children can lead to heart disease in adults. And those are things like high blood pressure, high stress, things like exposure to tobacco smoke. And more importantly, the American Academy of Pediatrics has a really good emphasis on adequate exercise and excellent nutrition in children.
Speaking of exercise and activity, I know I have 3 little ones and I try to keep them as active as I can, even when it's really cold outside. I send them outside with hats and coats on. First of all, how much activity do they need? And what are the real benefits to their heart health when it comes to activity?
So that is a little bit dependent on a child's age. So for toddlers and preschoolers, actually 3 hours of activity a day, which could include things like playing on the floor or being outside, running and playing like you described your children. Once you become a school-age child, 5 or 6 years old, through young adulthood, it's actually 60 minutes of moderate activity most days of the week. And so what is moderate activity? That's breaking a light sweat. So most days of the week, you should be breaking a light sweat for about an hour. And then on top of that, 3 to 4 days a week of strength and muscle training. And those are all crucial for continuing healthy lifestyles through adulthood, for continuing to have healthy hearts, and for also bones and social. There are lots of other benefits that come with exercise.
For everyone, just to get, at least, like you said, younger kids get a lot of activity, but even when you're older, that 60 minutes is important. Let's talk about some signs and symptoms that parents and caregivers can look for if their kids' heart health isn't well. What do they need to look for?
So let me just start by saying that luckily, most children who have heart symptoms don't actually have heart disease, which is a good thing. But there are some things that would most likely be referred to cardiologists. So for example, if your child has chest pain or fainting, especially while they're being active or running, those kids are almost certainly going to end up being seen by a cardiologist. And then there are other things like palpitations or dizziness, lightheadedness with standing. Anytime that your doctor hears an abnormal heart sound, they'll probably end up at a heart specialist as well, depending on what a local physician's level of comfort is in dealing with that.
And let's talk about some differences between heart conditions between children and adults.
Mm-hmm. That is such a huge question. So thankfully, it's pretty easy. Children have not lived long enough, with very few exceptions. They have not lived long enough to have the type of heart disease that adults have, where they have clogged blood arteries in their hearts, or hypertension from just lifestyle changes. So in children, it's mostly things that they're born with, or potentially illnesses that cause some congenital heart diseases, things like that. But children simply have not lived long enough to have the heart disease that we typically relate to adult patients that have heart attacks and chest pain and things like that.
Excellent. That's good to know. Dr. Harrison Cobb, we appreciate your time and your expertise, especially when it comes to children's heart health during Heart Month. Is there anything else that you would like to share with our audience for Heart Month?
No, thank you so much. But just I encourage everyone to try and exercise and eat healthy as much as you can. I know it can be a struggle, but it is absolutely worth it. And we live in such a beautiful area. There's so many opportunities to get outside, to enjoy the creation that we were placed into around us. And thank you again. We're always here to help at the Arkansas Children's Northwest Cardiology Service.
Excellent. And if you do have a question after watching this video for Dr. Cobb, please leave it below and we'll make sure he sees it and we will get it answered. But again, we thank you for joining us. We thank you for watching. And as always, please continue to wear your mask, wash your hands, and social distance when you can, and stay healthy. And we'll see you next time. Thanks for watching.